So yes, thank you so much for, my name's Nicole Core. I'm the Marketing Director here at Medigold Health and I manage our webinar programme. And I'm delighted to welcome you to Avoid the Festive Hangover, an awareness webinar to help you keep your people and your business safe this party season. The webinar will be recorded and you will get a link to the recording either tomorrow or Friday at the latest. So feel free to circulate that to anybody within your organisation. There's a Q&A function at the bottom of the screen, so please feel free to use that throughout the webinar to drop any questions in. We will have a Q&A section at the end of the webinar session where our panelists will try and answer as many of those questions as possible. So please just pop them in there and we've got somebody behind the scenes working on those. I will hand over and introduce our panel, our lovely panelists here. So I've got Katie, do you want to just say hello and introduce yourself?
Yeah, thanks, Nicole. Hi, I'm Katie Wery and I'm the Chief People Officer here at Medigold Health.
Thank you. And then James, or as we know him, Jim.
Morning, everybody. Yeah, so I'm James, Jim, either, it's fine. I work in the training team within the Hampton North Department of Medigold Health.
Fantastic, thank you both. We've got a full agenda actually for the session, but we do, as I say, we do have time at the end for Q&A as well. We'll be covering key legislation, how to foster a preventative culture within your workplace around alcohol and drug misuse, and support, your obligations as a responsible employer, and how to sort of ensure Christmas festivities run smoothly. Some shocking stats around alcohol misuse, a bit of awareness and understanding units and the morning after. Then Katie and Jim will both cover a couple of workplace scenarios and go through how to effectively handle them. And then we'll look at how you can support employees that may have an issue with alcohol or drugs. And then we'll go into a Q&A. So without any further ado, I'll put myself on mute and I'll hand over to you, Katie. Simply say next slide, please, if I'm not on the ball.
Thanks, Nicole. Well, we'll go straight on to the next slide, if that's okay. So on here, we are just talking about some legislation. So within any sort of alcohol and drug misuse, there is legislation that dictates in some areas what we need to do. And some of you will work in regulated areas that are relevant to that sector. So we've listed them here. Take a note of them if they're relevant to you, and then yeah, have a look at what's in them. Nicole, do you want to just move to the next slide? Thank you. So this is around a preventative culture. So hopefully you've got a drug and alcohol policy. If you haven't, it is something that you really need to consider doing, and think about the tone of that policy and what you're wanting to set. Certainly at Medigold, how we would always want to treat people is how we would want our family members or a friend treated if they were suffering from an addiction or issues with drug and alcohol themselves. So think about, if you have got a family member, how would you like their work to approach the situation if they let them know? So make a safe space, make sure that employees know it's confidential if they come to you. Talk to employees about what's available to them. If you have got a policy, communicate that policy to them and be clear in the policy what support services are available. If you've got EAP, if you've got occupational health, there may be different rates, but how can they raise their concerns to you? Training for managers. So managers may not know how to deal with it if somebody comes and talks to them. So implement regular training for them. Also support for the managers as well, so that they can understand what to do and also where they can go for help. And actually your managers can use EAP as well if you've got that service and they need to, or they can reach out to the HR team, who should be able to guide them more for that. Make it, or ideally, you don't want employees to fear disciplinary. If they come to you and say that they do have an addiction, or they are suffering with a reliance on alcohol or drugs, then talk to them about how you can help them with that, and what other things you can do, what support services are available. If you're in a regulated area, it doesn't mean that they need to be dismissed. Is there another part of the team that they could work in that's not regulated? For example, if they were a forklift truck driver, is there an administration role that they could do for a period of time whilst they were being supported? So look at different options for them, and make it known that the first port of call wouldn't be that they would face disciplinary action. If you're able to look at alternatives, there will be, there are some roles where if they are, for example, if they were a lorry driver and they attended work and they had been drinking, where you may have no other option than to investigate that and lead to disciplinary. But if there's alternatives, then try to do that first. You might have a counselling service that you can refer them to. If you don't, then you could talk to your occupational health to see if there is a service that they have. And again, EAP would likely be able to help and refer to counselling as well. So a stat for you, just 27% of employers currently provide information to employees about disclosing a problem with alcohol and/or drugs. And I would just ask you, if you're in that 73% that don't, which will be a lot of you on this call, really think about what can you do to communicate to your employees, and also to talk to your leadership teams about how you can foster an environment where people feel that they can come and talk to you. I'm sure many of us on this call know people that do have a reliance on alcohol, and they may be friends and functioning very normally, but think about how you would like them to be treated at work. Back to what I was saying at the beginning, how would you like them to be supported? Next slide, please, Nicole. So the Christmas party, which is maybe the reason why many of you are here, to find out what are your responsibilities with the Christmas party. So the first thing to say is don't stop the Christmas party. You can still have a Christmas party. It's just about being sensible to make sure that everyone's responsible in that. So the company may be vicariously liable for actions committed by employees if they can't demonstrate that reasonable steps were taken to manage or prevent poor behaviour. I'll talk later about a scenario where an organisation actually fell foul of that, but I'll give you some hints and tips on things that you can do to prevent that. It does also include the after party. So if you're providing drinks throughout and then people go on to an after party afterwards, then it could potentially include that. But there's some specific scenarios for that, which I'll go through later. So how can you prevent it? Is there additional activities you could put on as part of the party which are not focused on alcohol, which might detract people's attention from drinking Jaeger bombs at the bar? Can you limit the number of drinks per guest? So maybe give kind of drinks vouchers for 2 to 3 drinks, ask the bar if they can only serve single measures rather than doubles, and take Jaeger bombs off the menu. Consider implementing a standalone policy on work-related social events. So there are model policies out there. I don't know if any of you are subscribed to HR Inform, but they've got a policy on there as well. So you can consider a standalone policy for that. And also, the best thing you can do really is communicate about behaviour expectations prior to an event. So if we move to the next slide, we have written a draft communication that you might find helpful. So we've tried to pitch it so that it's not miserable and that everyone will have a nice time. And we want everyone to have a nice time as well. But what we have just put in there is that there are the same behaviour standards expected as you would in work hours, and that all the workplace policies still apply. And that's what you really need to get across, is about the workplace policies, because your disciplinary process will still apply in the situation if you absolutely needed it. For example, if there was sort of harassment or violence. And we've also popped in there at the end about making sure that they arrange for a safe journey home, to hopefully kind of subtly saying there, don't drive home. This is going to be available. So when Nicole sends out the slides either tomorrow or Friday, this will be made available to you. So, and you're very welcome to use it in your teams if you find it useful. I'm going to hand over to Jim now.
Okay. So if you jump onto the next slide for me, please, Nicole, that'd be great. So we're just going to have a look at substance from a statistical point of view and a unit point of view, and a little bit deeper into what it is. And if I just give you a second just to absorb a couple of those stats on the screen, whichever ones pulls your eye in. What they do highlight and what they are showing us is current UK consumption, what's actually going on out in society with our workforce when they're not at work, when they're consuming alcohol, and how they're accessing it. And what it does start to show you, even though there's one stat there at the top, the 12.5%, which talks about the teetotal element of the UK. That's about 8.5 million adults within the UK. So that leaves quite a few that are drinking. It's about 1 in 8 that are estimated to be teetotal, and about 7 in 8 that are consuming alcohol. Now, there's nothing wrong with consuming alcohol, but what you will find from a couple of those stats, top left-hand corner, 70% consuming at least once a week. The 20% statistics highlighting how frequently people are consuming lagers or wines on a weekly basis. And down the right-hand side, top right-hand side, you can start to see how it highlights the amount of percentages of men and women that are consuming on a regular basis. Now, regular doesn't mean there's a problem. Just because you're consuming routinely doesn't mean there's an issue there. But we'll look at this in a little while. There is no real safe level of alcohol. When we look at guidelines, and I'll look at that in a minute, the guidelines are never a target, and they're never, if I stay within the guidelines, everything's okay. Alcohol is still a substance that affects our body on any level. So any consumption of it can have an effect on us. But when we get above the units and we start consuming more regular, it just hires the risk level ultimately. Now, like I said, some of these stats, and Nicole's going to be sharing all this with you, so don't worry about jotting every single thing down. It's not a problem. We're going to share the info with you. When you dig a little bit deeper behind some of these stats, because what's on the screen at the minute is highlighting kind of the consumption side of things, bottom right-hand corner starts to highlight some issues around driving and alcohol, the amount of people that are being arrested for drink or drug driving in the UK, the amount of accidents and unfortunate fatalities that are then caused by some of this. But when you move away from the accident side of things as well, and you just look at what alcohol does on a social level, about 70 people per day lose their life because of alcohol in this country. That's gone up about a third since 2019. So from just before the pandemic, we've seen almost a third increase in the amount of people that are dying from alcohol consumption in this country. We're seeing issues with it driving health inequalities. People that are coming from deprived areas are twice as more likely to die from alcohol at some point in their life than someone who comes from a more affluent area of the country. And there's definitely issues there. There's definitely risk factors there. It's linked to roughly about 7 types of cancers at the minute. So there's definitely some problems there with not so much how we access it and when we drink it, but that regular, routine, frequent consumption of it, what it can start to do to the body. Nicole, if you want to jump on one slide, that'd be great. So obviously, when we look at what alcohol is, and this is not something that most of us consider very frequently, it's all about units. Most of us, I'm pretty sure, will base our alcohol consumption on how many did I drink, how many glasses did I empty, how many did I buy at the bar. It's very rare we'll take a notebook and pen and jot up all the units that we're consuming over the course of those drinks. But that's what alcohol is at the end of the day. Alcohol isn't a glass, it's a unit. And on the screen, there's a couple of different units from different types of drinks and serving sizes. But this links into what I mentioned a second ago about the Chief Medical Officer's advice around recommended guidance. So it's estimated that we don't consume more than 14 units per week. But like I said, that 14 unit isn't a target, and it doesn't mean that anything below 14 units is safe, because any consumption of alcohol has an effect on us. It just means if you're regularly consuming below, you lower the risk of what alcohol can cause to you. And if you're regularly consuming above the 14 units, you're going to increase the risk of what alcohol can do to us. Now, like I said, the thing with consuming alcohol, it's very rare you're going to go and order exactly 2 units every drink. It's very rare you're going to jot down how much you're consuming, and you'll base most of your consumption on, I had a couple, therefore I didn't drink too much, or I felt okay, so therefore I couldn't have drank that much. But that's just a feeling that you're going through. That's just your body's reaction to alcohol consumption. That's got nothing to do with the amount of units that you're putting into your system. And I'll show you some stuff on this a little bit later, but you can consume quite a small amount of alcohol in quite a lot of fluid. And you can consume, on the flip side of that, a lot of alcohol in a very small amount of fluid. And if you're not thinking about what's in the glass and all you're ever thinking about is the amount of glasses that I'm drinking, you actually haven't got any real control over your alcohol consumption. From a safety point of view, you don't know if you're fit to drive, you don't know if you're fit to work. And from a health point of view, like I said, if your consumption is based purely on, when I do drink, it's only ever a couple, I actually don't know how much I'm drinking. I don't actually know how much it's affecting my health and how much I'm consuming on a regular basis. Nicole, do you want to jump on one slide for me? That'd be great. Now, in terms of units, in terms of when they're in our body, how long it takes to process them, we're all different. So you can only use a bit of rough science on this in terms of how it works. And we are all very different. None of us are the same, so we all do this differently. But we know it's roughly about 1 unit, 1 hour in terms of consuming it, getting it into the bloodstream, getting the body to break it down and remove it from the body. So it's roughly 1 unit per hour to get that unit out of your system and clean it out of the body. Now, the more frequently you drink, your age, your height, your weight, your stress levels, your hydration levels, the types of drinks that you drink, how frequently you consume it, all has an effect on this. So you just can't take it as it's always 1 unit, it's always 1 hour. It will be different from one person to the next. I've spoke to a few people about this over the years, and sometimes I'll get the heavier drinkers say to me, well, I drink more and I can handle my beer better, and therefore it doesn't affect me as much. Well, you might be able to drink more and it might take you a little bit longer to get drunk. But in terms of the amount that person's drinking and the effect it's having on their body, I would say it actually takes longer to get out of their body because their liver will be in a worse state. It won't be as healthy as someone who doesn't drink as much. So even though the heavier drinker might think, I'm okay, I can drink twice as much as anyone else before I've got any problems, that doesn't mean the alcohol's left their system. And I would probably say it takes longer to come out of their system because the liver's in a worse state, like I said, compared to someone who doesn't drink as much. Now, obviously, this is just an average, this 1 unit per hour. The more we drink while we're drinking affects it and slows the process down. What we eat, everything affects it. But if we can create a more sensible approach in the workplace, educate our workforce, give them knowledge and education, hopefully they can make better choices when they are drinking and when they're not at work about how much they're consuming, not just on a glass, but on a unit. Consider their safety a little bit more, consider their health a lot more as well. And Nicole, if you want to jump on one slide for me, that would be great. What we need to consider then, like I said, is about one, there is no safe level, like I said, of alcohol consumption. Just staying below that guidelines, like we said, lowers your risk. Being routinely above it, which you won't know you are if you're not considering units and you're only basing it on glasses consumed, heightens the risk, obviously. Now, from a work point of view, yeah, it can affect your function, your mental clarity, your attention to detail, your general social awareness around you, your spatial awareness around you, makes you more susceptible to errors, incidents, accidents, poor performance, increased sickness. And the more we consume anything, even if you think about, food, if we eat unhealthy food and too much of it, it affects our health and we perform worse. So in terms of alcohol, it's no different. The more we consume, the more routinely we consume it, the more potential we have of not only affecting our health, our immunity levels, sickness rates, absenteeism rates at work, but also our performance when we come into the workplace. It can affect our sleep, it can affect our mental clarity, like I said, our general demeanor, our interactions with people. And I think with alcohol, it's so ingrained into our culture in this country, it's very easy to forget what it is. If this webinar was about, this seminar was about drugs, it's a bit more alien to most of us. But alcohol is so common in this country, globally as well, but especially in this country, so cultural. It's just really easy to forget what it is, to overlook the problem sometimes. I drink routinely, therefore I'm in control of it. I haven't got a problem. Now, drinking routinely doesn't mean you've got a problem, but drinking routinely, as Nicole and Katie mentioned earlier, and functioning absolutely fine, functioning alcoholics who you wouldn't even be aware there was an issue with, it slowly just breaks down the system. It slowly just makes everything much harder for the body to do. So yeah, we need to consider, like I said, keeping that mindset of there is no safe level. There's recommended guidance, which only lowers my risk, but the more I consume, the more susceptibility I have for health issues, safety issues in my private life and in the workplace as well. Yeah, Nicole, you want to jump on one for me? That'd be great. Now, as we said, Katie mentioned this earlier about training and policies and education to the workforce. This is just another piece that's really important when you do that. Highlighting to the workforce through knowledge, through awareness, through education about not only the side effects of alcohol and how it can affect us and our safety and our health, what we've just mentioned, but also how it can be a benefit to the business, improve the environment when we've got employees that are taking a more sensible, responsible approach to their alcohol consumption, being a little bit more aware of like I said, what's in the glass as opposed to how many glasses they're drinking, being a little bit healthier, being then for a little bit safer. But when we start to consider drinking more responsibly, yeah, obviously the employee's health can improve. Like I said, same as food. We eat healthier. We are healthier. We consume less drugs because that's what alcohol is at the end of the day. The healthier my body becomes. It can improve productivity, general morale within the workforce, lower absenteeism, reduce the risk of accidents, incidents, confrontation between people when they're under the influence, because we all know we're not the same person when we're under the influence of alcohol and we'll behave differently. But when you dig into, again, some of the stats that sit behind what problems is alcohol causing the UK workforce, on an annual basis, it's very rarely any lower than around about 17 million working days lost each year because of alcohol consumption in the UK. It's estimated that there's about 200,000 people every day somewhere in the UK at work under the influence of alcohol. Now, that might be in that 200,000 people, someone with an addiction, someone just blind drunk, someone just a little bit hungover, or a combination of those things. But an estimated 200,000 every day somewhere within our workforce at work struggling from the effects of alcohol. It's also estimated to be connected to around about 40% of accidents and incidents and work-related issues in the workplace. Nicole, do you want to jump on one more for me? That'd be great. Now, when we consider controlling this, like I said, you're never going to go out for a drink with your notebook and pen and jot down everything you had and do some maths at the end and work out what you've consumed. No one's going to do that. But it is very easy to know kind of what I'm drinking, what I typically like to drink, how strong that typical drink is. I'm a Guinness fan. It's a fairly weak drink. I don't drink it because it's weak. I drink it because I like it. And that's why most people consume alcohol, because they like the taste. They enjoy how it makes them feel, or socially drinking, obviously. But what these two examples highlight on the screen is what I mentioned earlier. I'll come to the two yellow blocks at the bottom, but if you consider someone drinking for 3 hours, those 3 hours are going to be different for all of us. What have I done the day before? Have I been drinking water? Am I hydrated? Have I eaten? Have I been too busy at work? So I skipped my lunch, got home late, skipped my dinner and went straight to the pub. Did I have something? Have I had a day off? Am I rested? Am I sleeping well? It all affects. So those 3 hours at the top bullet point about consumption will be different for everybody in terms of what they drink and what state their body's in when they're drinking. But what it talks about here is 4 pints of lager, 4 glasses of whiskey. So 8 glasses in total, 2 different drinks. Now, if you consumed alcohol at the defined amounts, and all alcohol is defined as 1 unit, whether it's lager, whiskey, wine, spirits, whatever it may be, there's a definition of how much of that fluid you would need to drink to have 1 unit. Now, the only problem with it is, even though this is how we produce and kind of sell alcohol, it's not how we serve it. So even though we produce it and kind of control it on a 1 unit basis, when you go to the pub and you order a pint, not all pints are 2 units, not all glasses of wine are 3 units. It's always different. But what this talks about here is the very controlled amount of alcohol, if it was a controlled environment. Now, those 8 glasses of alcohol, those 4 pints, those 4 glasses of whiskey, if sold at 1 unit serving sizes, which they're not in reality, would be 12 units of alcohol. Now, the reality is, as you look at the bottom left-hand corner, you can see that for a start, the lager there is only 3.5%. That's what dictates the 1 unit. And for whiskey, it's looking at a 40% drink at 25 mil. Now, the problem with that is optics these days are 35 mil, 50 mil, 75 mil. If you look at beers and lagers and ciders, you know, the strength of those drinks are 3, 4, 5, 6, 7, 8%. Depends what you want, really, even lower. So the reality is those 8 glasses that equates to 12 units of alcohol on the screen, they're probably more like 20 these days in the pub. So you'd be drinking more anyway than the defined amount. But what this example shows you on the bottom right-hand corner, now we've deliberately picked cider because it's a fairly strong drink. But at 7.5%, which is a typical cider these days, they are generally 5, 6, 7% drinks. You can see you can actually generate more alcohol, more units in 3 pints of the same drink than you can 8 glasses of 2 different drinks on the bottom left-hand corner. And this just highlights what I've been talking about the last 10, 15 minutes. If we don't think about what's in the glass, how on earth am I meant to know how much I'm consuming, whether it's I'm below or above these 14 units? If I'm drinking, I know it's having an effect on me, but if I don't know how much I'm drinking, am I in line with the guidance? Am I lowering my risk? Am I heightening my risk to alcohol consumption? I don't know. Am I safe for work the next day? You know, waking up, like I said, and just going, I had a couple, feel okay, therefore should be okay to work today. That's a really risky way to manage my consumption and whether I'm safe to drive or be at work, or, like I said, from a health point of view, how healthy am I? How much is this alcohol affecting me? So yeah, just having that kind of unit mindset is a very, very quick, very easy way to cascade the right information to your workforce and kind of highlight, look, of course, when you're not at work, you know, we're going to organise a Christmas party, or it might not be a Christmas party and you're drinking at home with friends. You know, companies have got to accept, and obviously would accept, that when people aren't at work, they're going to choose to drink if they choose to do so. But if we can educate them on the right content, then hopefully they'll just make better decisions. I have got work tomorrow. I need to consider what I'm drinking. I don't drink a lot, or I don't think I do, but I do drink 3 or 4 times a week. I might be drinking more than I realised. I haven't actually stopped to think about the strength of my drink and how many units are going in my body. So yeah, it's a simple angle to come from, but one that's so easily understandable and works for a lot of people in terms of their consumption and the effect that alcohol's having on them. Yeah, Nicole, do you want to jump on one? Okay, I think it's you
Yeah,
first.
thanks, Jim. It's over to me. Thank you. Do you want to move on to the next slide? So we've got a couple of scenarios. I'll do one and Jim's going to do one. And actually, the one that I'm going to do is there's a tribunal that links to it. So I say tribunal, actually, it was a High Court case. So I'll talk about that. But what the scenario is, after a company Christmas party, a group of employees staying in a nearby hotel on company expenses decide to keep drinking together. In the early hours, there's an argument between a managing director and an employee in which the employee questions the MD's decisions. The MD assaults the employee, causing a brain injury. The employee sued the company for being vicariously liable for the assault inflicted by the MD. So firstly, what's vicariously liable? So the principle of vicariously liable is that an employer is held responsible for the acts of its employees when they are acting in the course of employment. So what is important to note is whether the employees are acting in the course of employment during the event. So that goes back to the comms that we had put up about preventing people or saying to people that they should be behaving in the way in which they would at work and the workplace policies apply. So in the case of Bellman versus Northampton Recruitment, Mr. Bellman was a sales manager and Mr. Major is the managing director of Northampton Recruitment Limited. And this dates back to about 2011. They went to a golf club, they had their Christmas party at the golf club, there was lots of drinks flowing, and then they decided to have an after party afterwards. The taxes were paid for by the company, and I believe that more drinks were funded by the company at the after party afterwards. Mr. Major, the MD, had had a lot to drink, and he went off on a drunken tirade, lecturing staff, telling them that he can do whatever he thinks is right. So Mr. Bellman questioned that, and he questioned that Mr. Major's decisions, and Mr. Major didn't like it. As a result, he punched Mr. Bellman twice, he knocked him out, and he did cause a brain injury as well. So Mr. Bellman sued the company for vicarious liability. It went to the High Court. The High Court dismissed the claim, stating that it was a personal choice to have yet further alcohol long after the event had ended. But Mr. Bellman then went to the Court of Appeal. The Court of Appeal overturned the decision because the High Court judge had failed to take into account the nature of Mr. Major's role and the power and authority entrusted to him over subordinate employees. So because he was using that power and acting in the capacity of which of his role as MD, the Court of Appeal did uphold that the company was vicariously liable. What the judge did say, though, was don't let it stop you having Christmas parties, and it is a niche case, and it's because of the manager could be deemed as acting as part of his role of the company in that case. So it's one to be really careful of. I think also what I didn't mention before is potentially about having someone senior that's there just keeping an eye on things at the party as well. And if after parties are going to happen, then trying to ensure that in doing that, if the company's not continuing to fund alcohol for that either, to fuel it further. So thanks, Nicole. I'll hand over back to Jim.
Yeah, so this one's a little bit different. This is a little bit more in the workplace. An alcohol related scenario, obviously, of an employee coming to work and having a smell of alcohol in their breath, highlighting that it could be alcohol. The word could being key to this. Now, in terms of this particular scenario, it talks about an individual who's very aptly named, who's been at the company for 5 years, always on time, never really caused any problems. But what we have to consider with any sort of potential impairment in the workplace is we can't automatically just assume that it is. We don't know what's causing it. One thing on a lot of the training I deliver to clients on behalf of the business is about the human body and how it's not got very many ways to show you something's wrong. So in terms of how we display signs and symptoms from numerous reasons, we haven't got many ways to do that. And there could be lots of causes though as to why we're behaving in a particular way. It could be a drug, could be an alcohol, could be a medication, so something we've consumed. Could be a health related issue, could be an issue that we've got. It could be something psychological, could be stress, it could be anything that kind of affects how we change how we behave differently. But one thing we should be considering when we need to approach this, what we don't want to do is step into a situation, already prejudge what we think the cause is, and then impose that on somebody when we quite frankly haven't got a clue. Even though this one seems obvious, it's a smell of alcohol, therefore it must be alcohol. I don't actually know. I'm not 100% sure yet until I dig deeper into it. Anyone on the call who knows anyone who's diabetic, or if you're diabetic yourself and you know about hyperglycemia and hypoglycemia, you know, if you take a diabetic, for instance, who isn't managing it well and they dropped very low in their blood sugar levels, they look and smell almost drunk in their behavior. It's slightly different in terms of the smell that they give off and their behavior, but it looks very similar. And like I said, there are numerous reasons why we could be behaving in a particular way. So yes, we've always got to deal with it. We never don't deal with potential impairment within the workplace. We always have to do something. So one of the first things we could consider is, if I was a manager of an individual, that I get a second opinion first and foremost, if I can do so. Can I get someone else just to give me a bit of reassurance that maybe what I'm seeing or smelling or what I believe to be happening is also happening in their eyes as well. It's a good place to start if you can do that. Also considering a private area. This could well easily be alcohol, but this could be someone with an addiction. So I need to discuss this privately with them because I don't know why they smell of alcohol. And if it is alcohol, I don't know if they just got drunk last night. I don't know if there's been a bereavement in the family and they're struggling. Don't know if they've got an addiction. I don't know if it's any of those. I just don't know yet. So we need a private area to discuss it with them because we just don't know what's going to be coming back across the table in terms of a conversation we have with this person. So second opinions, private areas, always a good place to start. And in terms of your concerns and what we're discussing with this particular employee, it's not about, I need to talk about the alcohol concerns with you, please, because we don't know it's alcohol yet. It's about fitness of work. We've got a fitness of work concern that you can't work safely or might not be able to work safely at the minute. And that's where we want to start our conversations from. We would always say give that employee the opportunity to have somebody with them, not only to witness the conversations and the process that's about to unfold, but again, for support. This could be someone who's struggling. Like I said, maybe a bereavement in the family, and that's why they've been drinking heavily recently. Maybe they're developing problems or already got a problem and they want someone to support them through that conversation. Understandable. So always offer them the chance to have a witness in the interview with them and highlight your concerns. Don't be scared about talking about what you need to talk about. Just don't accuse that individual of anything. So around the smell of alcohol, you know, you'd never want to be saying, so did you drink last night? Or have you been drinking recently? Because I still don't know what the cause is. But what I could easily say is, look, this morning, both me and a fellow colleague have got a concern that you can't work safely. There's a fitness for work issue because we can smell alcohol on your breath and we don't know why that is. That doesn't accuse anyone of anything. That doesn't say, what did you do last night? Or have you been drinking? Or have you got a problem? It just says we can smell something, in this case, alcohol. We're not quite sure why. Help us understand. So you're still talking about alcohol. You're just not stipulating that they've consumed it in any way. You're also not showing this individual any favoritism because of who they are or how long they've worked for the business. We all need to be treated the same through these types of processes. I'm not going to judge them in any way. And like I said, predetermine what I think the cause might be. I don't need to talk about their private life. Again, when I deliver a lot of training to clients, a lot of the time I get managers say back to me, I'd probably just ask them what they did last night. Now, when we think about it, it's got nothing to do with us. That's their private life away from the working environment. And our policies around alcohol and drugs at work obviously stipulate we can't come back to work under the influence. We can't be consuming alcohol at work. But I can't be jumping into people's private lives and saying, what did you do when you're not here? Because that's not for me to manage as the manager. So stay away from judging them, showing favoritism and talking about private lives. If the person brings their private life into the conversation, ask them if they're okay to talk about that a little bit more. So you're always asking their permission to kind of go on to the next step. We need to consider our policy. If we haven't got one, consider having one so that we manage it in the correct manner, that we've got a procedure to follow so that managers aren't dealing with this differently from one case to the next. And we're following the process that says, this is what the procedure says next. These are the types of questions we should be asking in the order we should be asking them in. So like I said, so it's fair and consistent. Everyone's treated the same way. No different rules for different people. It's all about managing it fairly and consistently, but also robustly. So you need that policy and that procedure to do it in the correct manner. And ultimately, at the end of the conversations that you can have and the types of questions you can ask them around, can you explain, or is it a condition, or are you on meds, or can you tell us anything that might be contributing to this issue? One thing we might have to consider is in the policy and through the process, a test, a fitness or work assessment to actually quantify if it is a drug. Well, what drug is it and how much is it? And does that breach the company's policy or not? Because at the end of the day, some drugs are legal, some aren't, but I can't be impaired by any of them at work, regardless of what it is. So a test and a process and a policy can allow us to quantify some of that. Yeah, Nicole, do you want to jump on one? Now, in terms of approaching an employee, I've just started to touch on some of that. Now, some of it could be around impairment, like I was just talking that last case about someone smelling of alcohol. But it could be problematic alcohol and drug use as well that we're dealing with there. It could be someone developing an issue, or someone who's already developed an issue, or someone who just likes to drink and is complete control of the alcohol that they're consuming or the drugs that they're choosing to use. Now, one thing we need to consider is, like I said, how do we approach people fairly? You never want to get into the realms of will. It's more of a case of could and should when you're dealing with alcohol. May. It's the types of words that we use. So we need to speak to them, like we just said, in safe, confidential spaces, because we don't know the response they're going to give us. We don't know what's going to be said back to us when we start asking questions. We need to, though, also at the same point, highlight our intention. You never want to start a very friendly conversation and then halfway through bring an alcohol and drugs policy into the mix. You still need to highlight to the individual at the very beginning why we're having this conversation, what it's in line with, that we have an alcohol and drugs policy within the business. So the concern we have got is in line with that. So we're always very clear on what we're asking people and why we're asking them. Like we just mentioned about being non-judgmental, we need to think about not what you say, it's about how you say it. Like I just said on that last scenario, someone smelling of alcohol, I'm not going to ask them if they had a drink last night. It stipulates too much what I think might be causing something. But I can say, I can smell alcohol, help me understand why. So like I said, it's not about what you say, it's about how you say it, about choosing the words correctly that you're going to be using. Be very open-minded to about what might be said back to you, because you're never going to be fully up to speed with what might be causing what you're seeing. We don't ever expect anybody to be having a problem, but the reality is some will. It's estimated that about 10% of the UK adult population will struggle with addiction at some point in their life. That could be to alcohol or drugs or medication or to anything, for numerous reasons. And it's not something that just happens, but it happens to, like I said, a big chunk of the UK population, the adult population, about 10%. And it can happen to anyone. It doesn't matter who we are and what we do and the upbringing and life that we've had. It can happen to any of us. We're all potentially susceptible to it. It's to do with habits and the forming of those habits. And some people can form those habits much quicker than the rest of us. We don't want to use, like I said, certain terminology. Have you got a problem with drugs? Have you got a problem with alcohol? It's far too direct, like I said. So we've got to think about how we phrase the types of things that we're saying. And if you look down the right-hand side, again, there's certain words and certain approaches that we need to consider not using, not assuming or accusing people of things, not jumping to conclusions, Don't smell alcohol or see a problem in the workplace and jump straight into a disciplinary action. As businesses, we have to understand that no one does this deliberately. No one plans to become an alcoholic. No one plans to become addicted to illegal drugs. It sadly happens to a percentage of us. We need to consider that. And as businesses, we need to think about, right, okay, we have got a policy and we have got a process in the workplace, but can we help this person first and foremost? Has there been a breach of the policy? No, not yet. Okay, how can we help them? We still need a policy and we still need to use it. And any further breaches of the policy will and can be used as a disciplinary action, but we need to consider how we can help individuals first. And it's a very fine line between the two, between support and addiction, disciplinary action and assistance and guidance and counselling. And it's a very, like I said, very fine line to tread and a very difficult line to tread as well. So it's not as simple as what we think it might be to deal with. Especially, I remember when I joined the business, I worked for myself previously, so everything was, I was self-managed as a self-employed person for 20 years. So I didn't consider a lot of this until I came into a business such as Medigold. But very quickly, you start to think, working on the training side as I do for the business, you really do need to step back from substances that we're all aware of and are just very common in society, because we don't actually know an awful lot about them. And we stop and think, how do we deal with them? What actually are they? What are they doing to us? So yeah, it's a very careful process that we have to tread, but a process we have to tread, like I said, nonetheless. Doing nothing is never an option. We can't ever go, that's a bit difficult to deal with. I'm not sure if I'm comfortable doing that, so I'll just step back from it. We can't do that. We always need to approach and deal with these problems in the workplace, try and assist and try and help, and try and keep everybody safe as well. Yeah, Katie, back onto you.
Thanks, Tim. Yeah, thank you. So moving on to how you can support someone with an alcohol problem, and I won't take a lot of time on this because I can see there's some really good questions coming in actually. That one of them is a difficult, made me smile. It's a difficult day in the life of HR. But what can you do? So if you've got somebody who you believe is under the influence of alcohol in the workplace, firstly, make sure they're safe, make sure they can get home safe. Either give them a lift if they're comfortable with that and you are, or organise for a taxi for them to get home. But that needs to be predominantly the first thing, is to make sure that everybody is safe. We talked earlier about ensuring they know it's confidential. So they'll need to know that you may have to share some information with some people. So for example, you may have to share with their manager why they're not there and what they can do to support, but make sure they know who those people are and that they feel psychologically safe to share information with you, because it is confidential. You can encourage them to go to their GP for help, for support, or there's lots of agencies and charities out there that can support them and their families as well, because actually their families may be wanting to reach out to support them too. Signpost to EAP, and if they are absent, then stay in touch with them, keep about their welfare, talking about how they are, what you can do to support them, but also about what's going on in the business and regular updates. So when they are ready to come back, they feel informed and comfortable to come back to work. Nicole, the next question. That brings us on to questions.
That brings us on to questions. Thank you all. Thank you both so much. I've just stopped sharing there so that we can see you both at the same time asking the questions. And thanks ever so much, people that have popped questions in. We've got some great ones. Let me just have a little look. So we've got a few, this probably for Katie, I think. We've got a few employees who are a bit disgruntled with pay and work conditions at the moment. They're planning to make a bit of a fuss at the Christmas do. Are there any steps we need to take beforehand to keep things under control?
This was the one that made me smile, about a difficult day in life of HR. So you're obviously looking forward to the Christmas party because it's yours too. What can you do? I think firstly is about that communication, sending the communication out beforehand that people need to behave as they would do at work. You might want to be a bit more explicit from the comms. You could always use it as a template that we wrote, but then be a bit more explicit about what you kind of mean by that. Mm-hmm. Again, I would probably limit the alcohol that you're providing to people. And I think it's making sure the right people are there. Without knowing what the disgruntlement is, it's difficult to know what they're going to do and say. But I think the main thing is communicating with them beforehand about what the behaviour expectations are of the Christmas party. And finally, good luck. I hope it goes okay.
Okay, thank you, Katie. I think this is perhaps one for Jim, actually. Some of these conversations are, and a bit of Katie maybe as well, some of these conversations are a little bit tricky for managers to have with their workmates and colleagues. What is the best way for us to get them on side and make them aware of the issues that alcohol can cause?
I would say, prior to the issue and having to deal with it, how we cascade the information to our workforce. So the type of education we give them, the knowledge, the awareness, the training you give them on subject matter. Because it's, like I said earlier, it's all too easy just to expect everyone to just, it's alcohol, we all know what it is, so don't need to train people on alcohol, everyone knows what it is. It's too easy to forget what it is. So it is about, how do we cascade the right information out? Yes, we need to train our managers on how they manage this, but we can't leave the employees out either. How do we train them? How do we give them training? How do we give them knowledge? Can we do face-to-face training? Can we get them on some e-learning courses? Can we get some posters up around the business about awareness and units and content? Can we signpost them to drink aware? Can we give them additional tools? And it is a difficult conversation. I appreciate that, even if it's, you know, with a fellow colleague that you know very well, maybe away from work as well. But if you remove it from impairment for a minute and put it into an accident, for instance, and it was nothing to do with alcohol and drugs, but as a manager, someone at work had an accident and it was one of my friends, I still have to go and deal with it. I still have to deal with the situations that are occurring in front of me. So yes, I appreciate it's a difficult conversation to have, but we need to consider, if they are my friend or just a fellow colleague, if I know them externally or I don't, I've got to keep them safe. I've got to keep them safe from themselves. I've got to keep them safe from fellow colleagues. Also got to consider the company's reputation, because this employee at work, if I choose to do nothing, could not affect one of our own, but someone externally, a customer, a visitor, a member of the general public. So yeah, I've got to think about them first and foremost, making sure they're okay, keeping them safe. And that's where you want to come from. This is not about having a conversation to catch somebody out. It's making sure they're okay. Making sure there's no issues we can help them with, and keeping them safe as well. And like I said, it's keeping them safe from the potential risk they cause to themselves, but everyone who works with us and everyone else you could come into contact with.
Great advice, thank you, Jim. I am a health and safety manager and I'm working on implementing a policy. How would you say health and safety and HR should be working together?
Oh, do you want me to take that one?
Yeah, you can have that one, Katie.
Yeah, well, actually, there's some really good guidance on the HSE website that HR colleagues should be referring to as well, and that talks about support. So I think when writing the policy, I would say to collaborate with the HR team around, there will be things that health and safety, if you're working in a regulated environment, there's going to be limits of what, and this leads on to actually another question I think that I saw about if someone's working in a regulated environment and dismissing them. There are scenarios where, as supportive as you want to be, you just can't be. And if somebody is if they're breaking the law and they're driving under the influence of drugs, for example, so they were a bus driver with passengers and they were reporting to work drunk, then it's very limited what you can do in that scenario. They have broken the law ultimately, and whatever happens, you have got to put everybody's safety first. So I think that's what's really important, is that the health and safety team are very clear with the HR team, the safety aspects of the sector that you work in, and that the HR team are very aware of that when they are investigating any incidents that occur, and what support they can offer. And actually having conversations with health and safety. And as an what I would probably do as a HR person in some scenarios is possibly even use somebody in the health and safety team as the investigating manager as well, so that they know how the seriousness of what it is and what the tolerance levels are of somebody being at work under the influence of alcohol. That I'm going to just answer the other question there, Nicole, around dismissing somebody that has been under the influence of alcohol. If somebody has been under the influence of alcohol and you fully investigate it and you've tried to support them and there's nothing more that you could do, then again, you have got to put safety first. And actually there will be instances where, unfortunately, there's nothing more you can do other than dismiss them because you've really tried. But I think if you can put your hand on your heart and say that you have really tried, and but you know that there's a compromise of safety, or there's nothing more that you can do, or the business simply can't tolerate the level of performance anymore, or lateness, absence, etc., then there will be scenarios when unfortunately you're left with no alternative.
Okay, thanks, Katie. Yeah, that covers a couple of questions actually, because Holly, thank you for your question, who said, how would you advise that we deal with an employee who's attended work under the influence more than once and been sent home? We've provided all the support we have available. Is there anything else we should consider? I think you've covered that nicely as well.
Yeah, if you've done everything you can, then and I think it's having that conversation with the individual as well, this laying out to them what you've done to support them and making it clear to them throughout those stages how this could end.
Yeah. Okay. In your opinion, should the policy on drugs and alcohol be owned by a HR or occupational health? Of course, either way, it will have some input from either side, but there is a big push in my employer for the policy to be owned by OH, which will involve the majority of the work and decision making in managing alcohol and work. That's an interesting one, actually. I think that
is an interesting one. Certainly in Medigold, it's owned by the HR team. Yeah, we own that policy. My personal belief is that it should stay within the HR team, because you've got matters of confidentiality as well. People may not want occupational health involved. Their manager needs to go to them, and ultimately it feeds into the investigations, disciplinary, all of those things. So for me personally, it would sit with the HR team, but I mean, every organisation
agree.
Views.
It would go to OH if there's maybe a medical issue or some sort of issue, referral.
Yeah,
but actually the policy, sits.
Yeah, we would use OH as a referral. We would use OH for their guidance. We would use testing as well. So we would use alcohol testing for assurance testing as well. But OH wouldn't be the decision makers in anything. The managers are ultimately the decision makers, and HR would be there to guide them and seek the advice of occupational health.
Yeah, thank you. One for you, Jim, going back to some of the stats that you shared, of the teetotal people, is this people that choose to not drink, or is it a random selection of people? So it may include people that are also medically advised not to drink. I'm guessing it's a mix, is it?
Yeah, it would be a mix. Yeah, it wouldn't be that specific in terms of the types of people it was asking. It'd be a general population survey as such. So yeah, it wouldn't be just picking certain people with or without conditions, or were told or not told that they couldn't drink. So it will contain all sorts.
Yeah, okay, thank you. There does seem to be a bit of a movement actually towards teetotal at the moment, doesn't there?
Yeah, definitely. Yeah, there's definitely not less alcohol being drank, I don't think, but I think there's more reining it in a little bit, shall we say, than maybe 10, 15, 20 years ago.
Let me just have a look. I think you covered this actually, Katie, but just a quick one. Do we need specific wording for our company events or parties in our policy? I think you mentioned about maybe.
So you can have a standalone policy. I read some model policies and I read some model comms, and I did feel like the comms, certainly, it did feel very party pooper-ish. And there wasn't anything in there that said have a good time. It was like a page and a half of kind of this policy applies, that policy applies, etc. That's not how we would manage it here. I think we because we do want people to go and have a good time, and that's what the type of tone that we try to get across in the comms. That comms is actually something exactly like what we would send out to people. So yes, you could, I think it's just probably looking at what the model policies are and then just making it relevant to your business, but also not forgetting that there's company events, but there's also people may go to supplier events as well. So you could cover that under the same policy as to essentially how if people could be associated with work at an event, whether it be a work event or a supplier event, then what your expectations are, then that would probably be very useful to you. Should you ever have to kind of manage the situation.
Okay, yeah, great point.
What we've not talked about, Nicole, and what I often read on HR Ninjas actually is around harassment, and that unfortunately harassment happens at a lot of events, or can happen. So again, that standalone policy kind of can link into your harassment policy, that it still applies. And again, it's all those workplace policies still apply at a Christmas party or whatever event it is.
Yeah, okay, thanks, Katie. But about getting that balance about not the party pooper element as well. Yeah, good.
And that feeds into, actually, there's one of the questions that says, is it easier to just not offer company Christmas parties to avoid taking responsibility? That's not something that we would do. People at Medigold enjoy a party and enjoy a social event. So I think you need to weigh it up against morale and kind of where morale's at as well within your organisation. But I I mean, my personal view is don't let what a couple of people could do spoil it for everybody else, and just put the comms out there, be clear, be sensible, don't put lots and lots of money and allow doubles and all sorts of shots and everything at the bar. And also make sure that maybe do provide taxis home for people if you've got the funds to do it, so then you're avoiding people driving home.
Okay, great stuff. A couple of questions about testing, actually, so I think this is your sweet spot, Jim. So we've got Holly, thank you again. What is your view on drug and alcohol testing at work? And somebody else has asked something very similar in terms of what support is out there with regards to rolling out an implementation of testing in the workplace. Over to you, Jim.
Yeah, so in regards to testing, I do understand some people's nervousness around it, but it's the only way to quantify it. But at the end of the day, if we're dealing with substance, either socially or in the workplace, once you get into a workplace policy and it's very specific about what breaches are and what breaches aren't, without a test, you can't actually quantify that. You can't define that someone is or isn't impaired or isn't in breach of a policy. So testing for me, again, it's like all the other parts of anything to do with this. It's how you cascade it to the workforce. If they're not given the right education on it and understanding of what it is and how it works, they fear it a little bit and they think it's something that's being imposed on them, but it isn't. Because if you think about most of the UK workforce, we don't just knowingly go to work under the influence every day and won't need testing. We'll be fit for work, but there will be some that aren't. There will be some that, the 1%, as I always call them, that know the rules but drink drive anyway. No, they shouldn't be drunk at work, but do it anyway. That you're always going to have these people. There's always going to be individuals that have sadly got addictions and can't help bringing it to work. And when it comes to the point of actually quantifying it, it's about making sure that your testing part of your policy doesn't feel like some sort of testing regime. It's another tick in the box. It's another process that we can use to go, okay, it is a substance and this is what allows us to quantify it. If you look at alcohol, the easiest one to deal with is alcohol. It is legal, we can drink it. Look at the drink drive limit. We can have it in our system and be legally in charge of that vehicle under a certain limit. But without a test, how do you know that? You don't. You're just guessing. It's opinion. And it's no different at work. So it's about having that testing regime to quantify what we know is there now and what we know is in the system, and making sure we can understand the levels that we're dealing with. Without it, it's just opinion. I think you're impaired. I don't think that I am. Without a test, you can't go really any further than that. So you do need it. It is a vital part of the process, but you need to make sure it doesn't feel like the process. This is a testing policy. No, it isn't. It's an alcohol and drugs policy, a support network, a protection network. It has addiction treatment in there. It has guidance. It has knowledge. It has education. It has testing. It's all in there. But sometimes it's easy to see an alcohol and drugs policy as a testing policy at work, and it just isn't. It's just a part of the process. So yeah, for me, and I know for the business as well, it's a vital part of any one of these policies, because like I said, without testing, it's opinion. It's guesswork ultimately, and you can't do anything with that. So yeah, you do need it. What was the other question on testing, did you say, Nicole?
It was pretty much that. Well, what is your view on alcohol or drug testing at work, and then how about implementing how do you implement and roll out a testing?
Yeah, again, it's back to the training side. It's back to you never want to go surprise testing this morning. You obviously want to cascade it out correctly when the policy's put out there. Allowing the employees to have training, have toolbox talks, have briefing sessions about it, so they can ask their questions about, well, what does it mean and how does it work, and give me better knowledge on what the testing's all about. For me personally, I haven't got an issue with it at all, because I know I'm never going to fail it, because I'm not going to be impaired at work, and that's how a lot of people see it. But there'll always be that concern that there'll be the odd employee here and there who thinks, are they doing it because of me? Are they trying to catch me out? Have they got a problem with me? And they'll take it very personally. And when you stop and just think for a minute, we have testing. I've been tested working for the business before. It doesn't bother me, because I understand why we do it and I know I'm going to pass. So it's not an issue, and I get it. Keeps me safe, it keeps others safe, it offers support for when people need it. So yeah, I'm a big advocate of it.
Sorry, Nicole, I know we need to end, but I just wanted to add one thing on there, and about it being a safe space for people to tell you. So if you are doing testing, from our perspective, if from a HR perspective, it's much easier to deal with if someone at the point of testing has admitted what the test is going to come back with. So rather than saying that they're not going to have a substance inside them, and then the test comes back to say it's positive for cocaine or for alcohol, whatever it might be, it's much easier to deal with if they've been truthful to start with, because otherwise you've got an integrity issue as well as the fact that you've got the positive test. So I think creating, if you're going to test, then again, creating this environment where people understand that if they come to you and tell you, then that's much safer, that's going to be better than actually just kind of taking the test and failing it.
Yeah, no, that's a really good point to finish on, actually. Thank you. And it just brings me to the end. So just want to say a huge thank you to Katie and Jim. Great session, and a big thank you to our audience for tuning in and also all of your questions. I will be sending out the recording, as I say, in the next day or so. That will also have a download of the example comms that Katie talked through, and also some details at the bottom there if you do want any testing or training. If you'd like Jim to talk to your workplace about alcohol awareness, then we can help as well. So that will all be in the follow-up email. But just a big thank you to everyone. So that was a great session, and enjoy the rest of your day.
Thanks everyone. Thanks, Nicole.
Thank you.
There you guys.